Hello, everyone, and thank you for joining us today for our webinar to share the results of our 2024 State of Survivorship Survey. This is our sixth year to do the survey, to conduct the survey, and it's become really, really important to NCCS in terms of supporting all of our work on our policy work, our advocacy work, because we really get important data about the experience of cancer patients from diagnosis through treatment and post-treatment care. We've presented at a number of conferences. We've talked with researchers who have used the data to write papers and cite the data in their applications for funding, and we try to share the data as widely as we can because we really want this data to be useful to people. And we get ideas through all of our conversations throughout the year on how to, what questions to ask in the next year. We keep running lists of, as we have conversations with people and we get questions today. I'm sure we won't be able to get to all the questions, but we'll think about those as a way to, include them in next year's survey. Every time we add a new line of questioning, it opens up doors, and then we kind of delve further into it the following year. So it's been a really amazing project, and I want to thank our partners at Edge Research, Pam Loeb, who will be presenting today, but also the entire team at Edge, Liana and Marielle, who've really helped us over the whole 6 years we've been doing this. And also I want to thank the whole NCCS team who works really hard on this in terms of coming up with the questions and promoting it and sharing data with potential, researchers who are interested. And it's really a very much of a team effort. So thank you to everyone for their help. So let's get into, I'm going to go through a couple of slides and then turn it over to Pam to really dive into the data because she is intimately familiar with it, having conducted the survey and done the analysis. Next slide. But first, I want to thank our sponsors. Our presenting sponsor is Pfizer. We appreciate all of our sponsors, and we're really thrilled this year to have Stupid Cancer as our advocacy partner. This was a great collaboration. They wanted data on the experiences of young adults. And instead of creating a brand new survey, we worked together to make sure that our questions reflected the needs of their stakeholders and did the survey jointly. So we were really pleased to be able to partner with Stupid Cancer this year. Next slide. So our objectives this year, every year, we continue to explore the cancer patient and survivor journey. Last year, we added the caregiver component, and we continued that this year so that we would have multiple years of data on the experience for caregivers. A couple of other things that are new this year, we did, as part of that partnership with Stupid Cancer, we oversampled younger patients between ages 18 to 39 to better understand their experiences. And during the presentation today, we're going to point out a few of those areas where we saw differences for the young adults. We've consistently seen every year in our surveys that young adults have higher burden physically on their work and career, on their education, financial, mental health burdens. So we just had more young adults to be able to really continue to dive deeper into that. So we're going to show you some of the data points, and there will be putting out a more detailed report next month, and we'll share more details about the experience of younger patients and how it compares to the experience of older patients. We've asked for a number of years about participation in clinical trials, and this year we delved a little deeper to find out if someone did participate, why they chose to participate, and if they didn't, why they chose not to. We asked about getting a second opinion and reasons for or for not getting a second opinion. We asked about interest in oral treatment at home. We did a little bit deeper diver on post-treatment care, some of what are the barriers to post-treatment care, what kinds of survivorship plans people got, and how helpful they were. So those were some of the new things this year, and we continued our questions on working through a cancer diagnosis and caregiver experiences. So now I'm going to turn over to Pam to walk you through the data, and I'll chime in from time to time. Before I turn it to Pam, we will have this slide deck and an executive summary posted and the webinar posted by tomorrow on our website. You'll be able to download and view all of this information. There may be a few things in our survey or in this webinar today that we don't touch on, but just for time purposes, but that will be in the final report that's on our website. So now, Pam, please take it away.
Sure. Okay. So let me start off just kind of level setting and talking a little bit about the methodology. And the methodology has been consistent year over year. So most of the data that you're going to see in this report is from our nationally representative survey of cancer patients and caregivers, ages 18 and older. This year we surveyed over 2,000 people, 1,620 patients, including what we call an oversample of those younger patients, ages 18 to 39 that Shelley just talked about, as well as over 500 caregivers of cancer patients. And patients are, as Shelley explained, a mix of those who are currently in treatment as well as those who have completed treatment. And when there are differences, we'll point them out. And caregivers are people who have cared for a patient with cancer within the last 5 years. Most of these, their loved ones are still alive, some are deceased. Every year we conduct a parallel survey of what we call the NCCS connected audience. And though they are those who have chosen to engage with NCCS, this year also with Stupid Cancer and some other partner organizations. I'll talk a little bit more about that group in just a second. As we are going through the report, I just want to orient you to the key at the bottom of the page. When we're looking at differences by audience, numbers in blue mean significantly higher. Numbers in red mean significantly lower. That'll let you understand who's kind of popping on different questions. And we are also in some cases showing statistically significant changes from 2023. So that blue up arrow means higher, the down arrow means lower. And just to get back to kind of a comparison of our nationally representative patient sample and the NCCS connected sample, as you're looking at this data, and we're looking at the NCCS group in comparison to patients, just a reminder that we focus on this nationally representative survey of patients because the NCCS connected group are people who've raised their hands, they've engaged with a patient advocacy group, and they tend to be younger, they're predominantly female, they're also better educated, 50% have a postgraduate degree, higher income, more likely to have private insurance. So definitely a different group. Just think of them as the ones, the national patients as kind of Gen Pop cancer patient survivors versus those who are more active and engaged. So it's just one of the reasons why it's so important for us to do this nationally representative sample. So I'm going to kind of take you through 3 different sections. And what we try to do with this study is look at attitudes, values, and behaviors across the patient journey, starting with diagnosis and decision-making around one's treatment. So that's kind of the first set of slides we'll talk about. And every year we've asked a series of attitudinal statements to understand how patients and caregivers approach their diagnosis and treatment. There's a lot of data on this page, so let me just kind of point out a couple of things. Most patients are both focused on maintaining their quality of life as well as getting rid of their cancer no matter what. And I know that these two things might seem sometimes at odds with one another, but most people kind of hold both beliefs at the same time. Caregivers, on the other hand, are more likely to say that their focus is on maintaining their loved one's quality of life and finding out everything they can about their loved one's diagnosis and treatment options. The second is 15 points higher than how patients report on this particular statement. We included a new statement this year where we asked people how well the phrase, "I had to advocate for myself in order to get the best treatment and care," describe them. And about 35% of patients nationally said that this described them perfectly. What is interesting is some of the subgroup differences. So NCCS connected patients, as well as younger patients, are significantly more likely to say that they had to advocate for themselves, as well as Black and Hispanic patients, urban, those who live in urban areas, lower income, and women. And I want you to kind of remember those groups that I just talked about, because we'll see throughout the study that many of these groups struggle more throughout their journey. Another question that we've been tracking over the last 5 years that we've been doing this study among the national patient sample is how prevalent what we call a doctor knows best mentality is. And the data has been really fascinating. In 2020, you can kind of see a time series here. So the first is 2020. In 2020, we had 6 in 10 who said that they relied on their doctor to decide on their treatment decisions, and just 2 in 10 who said that they were very involved in researching and deciding on the best treatment options for themselves. This became more balanced in 2021, which was like kind of the first full year of the pandemic, with more patients reporting involvement and fewer patients saying that they just relied on their doctor. But since then, the numbers have trended back up. And today we have 53% or twice as many who say that they were really doctor dependent versus involved in the decision-making process. 20% who say that they're somewhere in the middle. And here we look at the same question by some key demographic groups. Again, there's a lot of information on this slide. So what I want you to look at is kind of the blue highlighted numbers that we have here, which is, I think, one of the more interesting findings. Half of younger patients, as well as half of Hispanic patients, say that they were involved in their treatment decisions. So this is significantly higher than any of the other subgroups that we looked at. If you just kind of compare them to older patients, seniors 65 plus, just 22% said that they were actively involved in the decision making versus 58% who said that they relied on their doctor. And the same numbers kind of carry through with Medicare and Medicare Advantage, which are obviously kind of the same audiences. When we ask patients to rank from the following items that you see here, how important each of the following is in making decisions about treatment, doctors' recommendations and likelihood that the treatment will work are significantly higher than anything else we asked about. This year, we actually added in a few new items, one of them being cost of treatment options, and just 14% say that this was one of the most important aspects of their treatment decision. However, this is twice as high among Hispanic audiences, Hispanic cancer patients, almost twice as high among younger patients, and significantly higher among African American patients. So there are definitely some groups for whom cost is a bigger consideration. And Shelley, I'm just going to invite you to chime in at any point, which I did not say earlier.
No, thank you. I think that, to me, that was kind of the biggest, the most notable thing here is how for the groups for which or for whom the cost of treatment is in their top 2 decision-making priorities.
Got it. Another question that we added in this year is, at any stage of the experience, did you seek a second opinion? And just 29%, or a little bit less than a third of patients said yes. Caregivers and higher, 39% said that their loved one sought a second opinion. Also higher among our more connected patients, and some of the groups that we mentioned earlier who are more likely to say they need to advocate for their treatment and care, younger patients, Hispanic patients, also LGBTQ patients. In addition to those who have metastatic cancer, those who are better educated, have a higher household income, and have private insurance. So definitely some groups who are more likely to seek a second opinion. Among those who said that they didn't seek a second opinion, again, it's all really about trust in the doctor and the medical team. 82% of patients nationally said that they just trusted their doctor and other healthcare providers. We have about a quarter who said that they just didn't want to wait to start treatment, and far fewer who listed any of the other reasons as why they didn't seek a second opinion.
Yeah, so I just wanted to chime in here because this is the first time we've asked this question, and I didn't really know what to expect. I do think 29% overall is lower than I would have thought. I'm not sure what the right answer is though, like how many should be getting a second opinion. I mean, we know that for certain types of cancer that are, that may be very aggressive or that may have newer treatment options that not all doctors may be aware of, it's more important to get a second opinion, and whereas others, it may not be. But I think it goes to patients feeling like they trust their doctor. Even though only about a quarter said they didn't want to wait to start treatment, I do think that is a factor. And they also need to feel that trust in their doctor because they're putting their life in that person's hands. And I mean, we do hear of people getting misdiagnosed or having to go to an academic center to get more specialized treatment. But yet a lot of people don't want to go outside of their home area. They don't want to travel or they can't travel. And so I think this is a really interesting data point. And I don't know like what the right answer is, like how many people should be seeking second opinions to make sure they're getting the best care. But I do think also the groups for whom this was higher, that they were more likely to seek a second opinion were also very interesting.
Yeah, and I mean, just kind of back to something that you said, it all is really about trust. And that's why I think we see this doctor knows best mentality throughout. 84% of our patients nationally say that they completely trust their healthcare team to act in their best interests. This is lower among some of the audiences that I keep mentioning: younger patients, Hispanic patients, LGBTQ patients, our NCCS crowd. And we actually added in an open end this year that I think just kind of underlines what Shelley was just talking about. So among those who say that they don't trust their healthcare team completely, how come? And kind of the three themes that we heard, and these are some indicative quotes here on the right, verbatim quotes. It seemed very much dependent on my health insurance rather than my health and healing. I didn't get enough information about treatment choices. And as Shelley mentioned, some people who said, I was just misdiagnosed several times. So that kind of eroded my trust in the healthcare team generally. So over the years, we have been asking if people participate in a clinical trial related to their cancer diagnosis. Consistently, about 1 in 10 say yes, although there are some groups that you see at the bottom of the page who are more likely to say that they participated in a clinical trial. What we added this year were some questions about why people participated and why they didn't. And what you see on the right-hand page is what influenced your decision to participate in a clinical trial. Again, a lot of it is about the doctor. 51% say it was the doctor's recommendation. 10 points lower, but also significant, are 4 in 10 who said that they wanted to contribute to science and help others. Far fewer said it was about getting access to new treatments or getting the best treatment option or thinking they get an improved or extra level of care. We also asked those who didn't participate, which was most patients, how come? And the number one reason by far is I just wasn't asked. 74% of patients say this is the reason that they did not participate in a clinical trial. We have seen this with other disease states that we have done surveys around. It is really about the medical team bringing this up. We do show you a few different breakouts by demographic subgroup. Younger patients and patients of color are slightly more concerned than others about treatment protocol and side effects, but these are really secondary to just not getting asked.
Pam, and so when we see that 51% of younger patients said that was not the reason, that means that they are more likely to be asked, right?
Yeah, they're more likely to be asked, or they are more likely to be asked, but that is not why this 51% is higher, because this was only asked of those who didn't participate. There are just other reasons that are also important for them. So that's
Okay.
why that one's lower.
So to me, this is one of the big takeaways of the survey, because there's a lot of work to try to increase participation in clinical trials. And a lot of that work is focused on trust, on educating patients about their options, on helping people with the cost of care, all of which are important. But it doesn't matter if they're not asked, and that is, a huge factor, and by far, as Pam said, the biggest factor. So I think that, in our advocacy, we need to really be addressing the structural barriers that result in people not being asked, and at the same time, we're trying to address the trust issues and the cost issues and the barriers to participation that I think a lot of the work is focused on. But if we don't address that structural barrier of getting people making it an option for people, then I don't think we're going to make as much headway as we need to.
Yep, definitely. So the last slide, kind of in this section, is about information sources. What resources, if any, did you use to get up-to-date information on your cancer treatment? And the blue bar represents the data from patients. The green bar represents the data from caregivers. And number one for both groups is the materials they get from their doctor and from the hospital. So of no surprise based on what we've been hearing, followed by Google and websites like WebMD. You can see throughout, though, that the green bars are higher than the blue bars, which just means the caregivers are more likely to seek out information overall, as well as from multiple sources. In fact, 19% of patients say they didn't seek out information, which is in some ways kind of astounding. They just didn't want to know. Finally, about 3 in 10 say that they're coming to cancer nonprofit organizations like NCCS and probably others on this call. And this is actually higher among younger patients, who are also more likely to say that they seek out support groups, social media, and video content in order to get up-to-date information about their cancer treatment and options.
I just want to add here that we did add video this year, and found that it really wasn't a go-to source for most, but as Pam mentioned, it was more for younger patients. But to me, the thing that stands out here is the 20%, 19%, almost 20% who say none of the above. And so again, I think that goes to, the people who trust in their doctor to tell them what to do. And it's overwhelming to have a cancer diagnosis. And sometimes there are people who just don't want to know, but you can see, obviously it's much lower for the caregiver. So I think that's why it's really important with our resources to make sure, and information, that we're targeting caregivers as well, because they're likely, they are more interested in a lot of these resources and can help the patients who say that they're not interested in this additional information.
Right. Okay, so now we're going to pivot and we're going to get into people's treatment experiences. And over the last few years, we have been asking patients how satisfied they are with each phase of their cancer journey. And what we've seen in previous surveys, and really consistent this year, are that the vast majority of patients are very satisfied with care at each stage, from screening and risk assessment through post-treatment care. At the bottom of the page, you just see that numbers broken out by our 18 to 39-year-old younger patients. And in most cases, satisfaction is 15 to 20 points lower among this group. So key group to think about and focus on, and something that we're going to be doing a deeper dive with Stupid Cancer on. The one exception, no matter what your age is how satisfied patients are with end-of-life planning and care. And we only asked this among metastatic patients and their caregivers, but just 27% said that they were very satisfied. If we kind of add in somewhat satisfied, that jumps up to 35%. 2 in 10 were neutral, very few dissatisfied, and 4 out of 10 said they just didn't know, which means that even metastatic patients are not really thinking about end-of-life planning and care, something that is incredibly difficult to do, but also really important. Here, same data in blue, and we've just kind of added the caregiver perspective in green. And you can see that they're like 20 points lower in their satisfaction at every phase. So they're taking kind of a more critical eye to what's going on. The one exception is end-of-life planning, where 39% say that they were satisfied with the help that they got. And that jumps up to 42% among those whose loved one is no longer living. Now we're going to get into who provided care. And this is there's a lot of data on this slide. So let me just orient you a little bit. The darker blue bars are the percentage who say that they saw each of these different types of providers during cancer treatment. So majorities report seeing an oncologist, an adult oncologist, a surgeon, drops to 48% who say that they saw a primary care physician. And this is actually about 6 points lower than last year. And then far fewer saw a cardiologist or a hematologist or a nutritionist or social worker. And in fact, there are several providers that we don't even have on this slide because the numbers dip into really like below 9%. So people like endocrinologists and occupational therapists and audiologists and speech therapists and fertility specialists. But for each of the different types of healthcare providers that people saw, we ask a follow-up question, and that is, how helpful were they during your treatment? And that's what that blue line that you see at the top of the page is, the percentage who say that each of these was very helpful. And the good news is that in every case, majorities feel that their various providers were very helpful, but there are some differences. So kind of most helpful, oncologist, surgeons, radiation oncologists, hematologists for those who saw a hematologist, nurses, 81% talk about how helpful their nurses were. A couple of groups to point out. So 48% said they saw primary care physician, and among those, just 71% said that that primary care physician was very helpful. So still strong numbers, but 20 points lower than kind of oncologists or surgeons. And I just want to point this out because we'll talk a little bit more about primary care physicians in a few minutes. Anything you want to jump in with, Shelley? Okay.
No, thanks.
Okay, great. So we also asked people about what side effects they experienced. And almost every patient surveyed say that they experienced some type of side effect. We just have 16 of the 32 that we asked about on the page here. But the 92%, that number on the left-hand side, is the percentage of patients who said that they experienced at least one of these things. The most common physical side effects, and this has been consistent year over year, fatigue, nausea, pain. We actually revised that that particular question. It used to be muscle or joint pain. We changed it to just pain generally. So the number who said that they had some type of pain actually went up. So those are some of the big physical symptoms. But there are also a lot of mental health side effects or side issues. So large numbers who say that they're fear recurrence. They're uncertain about the status of their cancer. 32% say that they experience or are experiencing depression, anxiety, and some type of mental health issue. And this is one of the things that's kind of impacting them the most. And then to the right-hand side, you see some demographic differences. And, just want to point out that women, African American, Hispanic, and younger patients are more likely to experience several symptoms, which is why you see a lot of blue in the columns for those audiences. And then here we're looking at the same data to the left, but on the right, we're breaking it down by those who are currently in treatment versus those who completed treatment. And while those currently in treatment are more likely to experience many of these different symptoms and side effects, there are still a lot of people in post-treatment care who are experiencing both physical and mental side effects. So just important to remember as we think about post-treatment care. I think the good news that we see in this data is that 62% of patients nationally felt like they were very informed about the potential side effects from treatment. Another 33% feel somewhat informed. That number is significantly lower among our NCCS connected group, which is probably one of the reasons why they sought out an organization like NCCS for information. A new question that we added this year, which you see on the right-hand side of the slide, is we followed up and said, did any of these side effects cause you to discontinue or change your treatment? And most said no, 79% said no. And there's not like a specific side effect that really pops in terms of what might have changed treatment. It's really kind of a smattering of all of the different ones. I'm going to go from kind of physical and mental side effects to financial impacts. So we asked people if they had any, as a result of their cancer, have they experienced any of the following types of financial issues? And while there's not like a specific financial issue that a large number experienced, overall, 44% of our national sample said that they experienced at least one of these, if not multiple, financial issues. And well, so 44% generally. And then if we look to the right, we can see some of the groups that are more likely to have financial stressors on them. Caregivers. So 69% of caregivers have some type of financial stress. 90% of young adults, 55% of African Americans, 68% of Hispanic patients, also higher among stage 4 patients, LGBTQ patients. And then what is interesting is that those with Medicare are less likely to say that they've had some type of financial impact versus those who don't have Medicare.
So Pam, are you still talking on this, or can I add a couple thoughts here?
I am done.
Okay, great. So a couple of things about this slide. So one of the things that we've always asked about type of insurance, and this year we asked Medicare among people who had Medicare, if they had Medicare or Medicare Advantage, traditional Medicare or Medicare Advantage. It's not something that we've really looked at before. And there were a few places where there was a difference. We do have to take that with a grain of salt because not everybody knows or realizes whether they have a traditional Medicare or Medicare Advantage plan. But I think one of the reasons we broke things out the way we did here is that because we have that our national sample is about half that are Medicare beneficiaries, they have really good insurance. And many of them have a supplemental plan that helps insulate them from some of the financial effects. We know that not everybody does, and that there are a lot of people who still have very high costs, but people with Medicare generally have better benefits than people who don't. And so when you look at the 44%, it really is, I think it's important to look at it by Medicare versus not Medicare. And that's why we did break it down this way, especially when we look at, the young adults that 90% have one or more of these. And then we did add a couple of new ones this year. They had difficulty affording prescription drugs, had trouble getting insurance to cover screenings, and then stopped, took less than, or switched medications because of cost. So I'm going to talk a little bit about this one because this is also related to Medicare. So in 2025, there is a new Medicare benefit called the Medicare prescription payment plan. And last year, and what it does is allow beneficiaries to smooth the costs over the course of the year rather than paying it all upfront. And we asked last year about interest in this, and it was pretty low, and we were a little bit surprised by that. So this year we asked about that average out-of-pocket monthly costs for prescription drugs so we could understand why the interest among Medicare beneficiaries was low. And I think it goes to what I was saying before, that a large percentage of Medicare beneficiaries have either a Medicare Advantage plan or a supplemental plan. So I think the importance of this program, which I think, many of us in the advocacy community advocated very strongly for, is that it's going to be very helpful, but it's for a small slice of the Medicare beneficiaries. And the importance is finding those people who will benefit. Because if you have a supplemental, and then last year, the first cap was implemented, and then next year in 2024, the cap of $2,000 for covered drugs will be implemented. So it's fewer people who are going to need this. So we did find that people in treatment are more interested in something like this because their out-of-pocket costs are higher. Younger patients are more interested because their out-of-pocket costs are higher. They're not eligible for it. It's just for Medicare beneficiaries, but they would like to see a plan like this. And Pam says that in other research that they've done, that young people are very interested in subscription type models. And that's kind of what this is a monthly payment. So the Medicare patients, only 30% are interested. And in part, that's because their average out-of-pocket cost is $873 a month. So it's not as high. So it's the people that have higher cost prescriptions that may not have the supplemental benefits to help them cover it that are really in need of it. So I think that the key for us as advocates is trying to help make sure those people know about it, and not to take away from this that people aren't interested. It's just that the people who are interested, we have to find them and make sure they know about it, because it is going to be very helpful to some, but not everyone, because of their supplemental insurance, and then next year that $2,000 cap.
Thanks, Shelley. So another set of questions that we added in last year, I think Shelley mentioned this earlier, was, and because they're related to kind of financial impacts, was some new questions around the impact of cancer on patient and caregivers' employment. You can see to the right the percentage who report that they worked during their cancer treatment. Half of patients, about 2/3 of caregivers. Remember, some people are retired. This year we added a follow-up question, and that's what you're kind of seeing in the middle of the page. And that was, did you have to keep working and not really have a choice? Did you want to keep working, or were you somewhere in the middle? And patients are pretty mixed, about a third. Slightly more say they wanted to keep working. And we actually did some qualitative research related to this last year. And what we heard is, it helps me continue to feel productive. It allows me to continue to socialize, and just kind of helps with my confidence. I mean, there's just a lot of kind of social and emotional reasons to continue working. The two groups that are the exception to this are younger patients and those who have been impacted financially from their cancer journey. So they are more likely to say that they just didn't have a choice. A follow-up question to this was, how did, if you just kind of think about a typical week, how much did your cancer affect your productivity? Your loved one's cancer affect your productivity? And majorities of audiences, both patients as well as caregivers, said it impacted their productivity to some degree. Again, this is higher among younger patients, particularly students. We also asked it about school, work and school. And most of these working patients and caregivers said that during their or their loved one's cancer treatment, they experienced at least one of the kind of work-related issues that you see in the middle of the page. The most prevalent being missing work. 39% of patients said they miss work, 42% of caregivers, followed by lost salary or wages, which is probably related to that. And to the right-hand slide, among those who did miss work, we asked them, in a typical week, about how many hours did you miss? For patients, it was about half of a work week, which is huge. And for caregivers, it was about 15 hours of a work week. So a lot of lost productivity during the cancer journey. The last kind of data piece in this particular section is focused specifically on caregivers. And caregivers are grappling with so much, as we all know. What we see here is the majorities are struggling with a combination of physical, emotional, and mental health issues during their loved one's journey. For instance, we see that 74% are concerned about having the emotional support that they need, as well as being there for their family and friends. But we also see physical impacts on caregivers. A new thing that we added this year was, how concerned are you about the impact on your physical health? 65% said that they were at least somewhat concerned. And we also see in the 60s people who said that they're concerned about maintaining a proper diet, being able to exercise, maintaining a healthy weight. So this is one of the reasons why we've added caregivers into this annual profile. And now I'm going to skip to our last section, and this is around post-treatment care and survivorship. So we only ask the questions that you'll see among those who are post-treatment. But among those who completed treatment within the last 5 years, 67% or 2/3 say that they're under the care of a healthcare provider for post-treatment medical care and follow-up. But that means that like a third aren't. A third who were in the first 5 years are not under the care of a healthcare provider. And for those 5 years out or more, those who completed their treatment over 5 years ago, just 32% say that they're in post-treatment care. So that means that 2/3 are not. Among those who are not in post-treatment care in any form, we asked, again, how come? And once again, it's because the doctor said that there's no need for post-treatment care at this time or anymore, which is obviously something that people want to hear. But that is really kind of the primary reason. Anything you want to add here, Shelley?
Yeah, I think, to me, the key point here is that a third of people that are less than 5 years out, 5 years or less out, are lost to follow-up, not being followed up. I think that's really high and concerning, and that 2/3 of people over 5 years. Now, I think, there may be people who don't need follow-up, but I don't think it's 2/3 of people who are 5 years post-treatment. So I think it's definitely concerning that a lot of people aren't getting follow-up care and that they're getting the message that they don't need it.
Yeah, I mean, particularly given how many people are also concerned about recurrence.
Mm-hmm. Yeah.
So we also wanted to understand who is managing post-treatment care for people. And this is one question where the numbers have shifted pretty dramatically over the last 3 years. So in 2022, pretty much equal numbers said that they were either seeing a primary care provider or an oncologist for that they were managing their post-treatment medical care. That number has dropped for primary care providers to 19%, so just about half who said that they were seeing a primary care provider in 2022 say that they're seeing a primary care provider today. And the number who say that they're under the care of an oncologist has gone up significantly. And if you look at the breakdown at the top among those who are who have just completed their treatment within the last 5 years versus those who were 5 years plus, you can see kind of how some of these trends are happening. So there seems to be a shift going on here. Because we saw a 10-point decline from 22 to 23 on those who are seeing a primary care provider, we did add a couple of follow-up questions this year. So specifically, we asked those who are not seeing a PCP, would they be willing to have a primary care provider manage their post-treatment care? Just about a third say yes, and that drops to 25% among the NCCS connected. And because we wanted to understand why this was happening, we asked an open end among those who were concerned about having a PCP manage this care. And the 3 quotes that you see here are, I think, indicative of themes that came out in the open-ended responses. They won't catch the symptoms if they come back, so that fear of recurrence. It's not their specialty. This just means extra doctor visits for me because I'm still going to have to go see an oncologist or another type of specialist. This isn't their field of knowledge. And again, we saw earlier that satisfaction in care during cancer care during treatment is lower with PCPs versus other providers.
Yeah, I just want to add, I mean, this is definitely, I think the decline in people saying that they're going to their primary care doc for follow-up care is, can be really concerning because I know there's a limited workforce of oncologists and a lot of cancer survivors. And there are some, there are models where certain, that kind of triage the needs of a cancer survivor and try to transition some cancer survivors with lower needs in terms of long-term side effects to their primary care physician for that follow-up care. But if there's concern on the part of patients and they don't feel that is going to meet their needs, I think that's a big challenge, I think, from a workforce perspective. We also, in previous years, asked about what do you talk about in your post-treatment visits? And it was very, very focused on scans to see if the cancers come back. That goes to that fear of recurrence, but that's what they're seeing these visits for, and not as much about addressing the long-term side effects. So I think those are definitely things to consider as we think about, how we make sure that people get the post-treatment care that they need.
And that kind of brings us to the last couple of questions that we asked in the survey. We did want to understand if people got some type of survivorship plan, and we actually spelled it out for people because I think we've had some false positives in previous surveys. So just about half, a little less than half, 43% of patients said that they received a survivorship plan. Similar numbers of caregivers said that their loved one got one. This does drop to just 32% among the NCCS connected, which is probably one of the reasons, again, why they're seeking out information from NCCS or another patient advocacy organization. The other thing that really stuck out for us with this particular question was that there does appear to be somewhat of an access issue. Those in rural areas or small towns are significantly less likely to say that they got a survivorship plan. Among those who did, 94% said that their healthcare team walked them through the plan. And when we asked specifically how the plan was provided, most people said that there was a conversation and that they got a hard copy. Patients and caregivers are mostly satisfied with the survivorship plans they're receiving. Again, this is a little bit lower among our more critical NCCS connected group. They might be more interested in more information. But speaking of what is included in those plans, we wanted to understand, A, what people remember was included in the plan, and that's what you see in the middle column, as well as what would be helpful to include in a plan like this, which is on the right-hand side. And in most cases, we were kind of looking like where there might be a disconnect. In most cases, they kind of align in terms of the rank order. But you can see, and this kind of goes back to what Shelley was just saying, most people are very focused on side effects future screenings, getting a summary of all the treatments that they've received, and just having a detailed description of the type of cancer they have, the stage, et cetera. People are less interested in some of the more kind of quality of life recommendations that might go into a survivorship plan, like diet and exercise and, support groups, and where they might go if they are depressed or anxious or have some type of mental health concern. And just kind of back to something I talked about many slides ago, the fewest want to think about palliative care, hospice, or just end of life care generally. Shelley, I'm going to pause, stop sharing my screen, and I don't know if you want to just add any kind of final thoughts. I have not been able to look at the chat, unfortunately.
Okay, no, I have been looking, and there are some questions. I know we probably won't be able to get to all of them, but I guess, one of the things on the survivorship care plans, I do think that the NCCS connected are less satisfied because they know what we think should be in a survivorship care plan and how helpful it can be. And we've definitely heard from people about getting a pretty generic plan that isn't actually tailored to them and their specific health circumstances, like a survivorship care plan that talks about frequency of recommended mammograms for someone who had a bilateral mastectomy. And so it was clearly like not a personalized plan to help them. And I'm not saying that's the norm, but it happens. And so I think that can be why people weren't satisfied with it. And someone asked about what the NCCS cohort represents. That's again, just people who are connected to us in some way. So they may be very actively involved in our cancer policy and advocacy team program, or they may just happen to follow us on Facebook or be on our email list. But we have seen consistently over the 5 years that we've separated the national sample and the NCCS sample that they are younger, more engaged in their care, have higher expectations about their care, less satisfaction with their care. I think it's interesting too that people aren't as interested in information about things that when in past years we've asked about concerns that were physical, mental, emotional, lifestyle, and they have a lot of concern about diet and exercise. But when we ask, what do you talk about in those post-treatment visits, or what do you want to see on a survivorship care plan, they are saying they're much less likely to say that they want that information, which I think is pretty interesting. One of the questions is there insight into why caregivers are more concerned about their loved ones' quality of life in their treatment options? I don't know if you wanted to address that, Pam, or you want me to.
I mean, I think it's because that's their job. Their job is to try to help their loved one maintain their quality of life. And honestly, as hard as it is to be a caregiver, I mean, at least you kind of have the physical ability and kind of the mental space to be thinking about those kind of higher level issues, not just like the immediate need to eradicate your cancer no matter what. I don't know, Shelley, if you have more to say.
I think so. I mean, I do think that the person diagnosed with cancer is more likely to say, and not always. I mean, there's definitely people who don't want to go through extreme treatments, but there are people who are willing to do whatever it takes, and yet their loved ones are the ones who don't want to see them suffer, so want that balance. It's not that they care more about quality of life, they just care about both in a way that I think patients are more likely to say, I'll manage whatever you throw at me as long as I can continue to survive. And we see that with the not abandoning treatment for side effects, because they're willing to take it because they want to get through the treatment. Let's see. There's a lot of questions that I'm trying to. One point is that the doctors saying that 64% of doctors saying we don't need follow-up, and what does follow-up mean? And are we talking survivorship care or just surveillance or for recurrence? So I think that's a really important point. We didn't, specifically define that. But at least the point is that they're getting the message from the doctor that they don't need to have these post-treatment visits. So I do think there's a lot more to dig into. And this report really is kind of like our first analysis of it, but I think there's, we can definitely, there were questions about, are there differences in certain things by stage of diagnosis or by type of cancer, tumor type. And I think, we called out differences wherever we could. When it comes to tumor type, with the sample size we have, we don't have statistical significance for every type of cancer. Pam, what are the top cancers that we see where we might have enough to be able to, dig into that? I mean, we do look for whenever there's differences, but there's only a few types of cancer where we have enough to say there's statistical significance.
I mean, the top two are breast and prostate cancer. Liana and Mariel got the cross tabs up, and they can probably send the other ones in the chat.
Yeah. Yeah. Great.
A lot of, as one person, one caregiver said, as a caregiver myself, my family member, it just went away, is more at peace with their terminal diagnosis and okay with passing than I am. And oh, okay. And then Liana just threw into the chat the other kind of places where we have enough completes where we can look at the data with confidence are skin, cervical, and colorectal cancer.
And one question is, what is the sample size of patients surveyed who are post-treatment?
That's another one that I need these guys to jump in on. I think it's about 2/3.
Okay.
Yeah, I think it's around 2/3.
Leanna's answering it, so.
Okay. She is fast on the.
Yes. So this is a really good question. Has the data shown a difference in satisfaction of survivorship care based on time since treatment? I've been less satisfied with my post-treatment care the longer I've been out of treatment. I don't know if we looked at it that way, but I think that would be a really important way to look at it. I know we've definitely looked at some things by time since treatment, but I don't know if there's been a difference in satisfaction or if that's something we can look into.
I mean, satisfaction with each phase actually is typically kind of higher the further away you are. But in terms of post-treatment care, we have not looked at that specifically by, how many years has it been? But that is something, that's a great idea. So I think that we'll definitely put that on our to-do list. And then you'll have another fun slide to share, Shelley. Not fun, but another good slide to share.
This is asking if there were respondents who had recurrences, and did that affect their mental health side effects? I know we had some who had recurrences. I don't know what percentage. Oh, it looks like Leanna's answering that. She's very fast.
Okay.
One thing I just want to mention too is so as we said, we'll update the website with the slides, the executive summary, and the recording of this webinar tomorrow. And there is also a form on the website if you are a researcher who wants to use the data. It just asks you to request the data and talk about how you're going to use it. And we have shared it with researchers. So again, this is an important analysis, but there's a lot more digging that can be done if you are a researcher who is interested in that. So there's a form on our website to request that if you're interested.
Anything else, Shelley?
No, I think that's it. I'm sorry that we didn't get to all the questions. We will keep all those questions and suggest some of our suggestions really of things that we can include in next year's survey. And we definitely consider all of those as we build this survey. Pam always tells me I have to delete questions because I want to add too many. So
I know Shelley literally brings this chat to our kickoff call, and she's like, and I'm like, no, that's going to be a 2-hour survey. So
Yeah.
we got to get rid of something if we're going to add something.
Yes. I want to thank everybody for joining us today. Thank you to the EDGE team, the NCCS team, and to our sponsors for making this possible. And we look forward to continuing the conversation about this important data. Thank you, everyone.
Thank you.